It was severe, it was quick, there was no warning, and I was down.
When Chris McGovern had a kidney stone attack last year, home alone, he needed medical care fast.
And I started to panic, thinking I was going to pass out, and I thought I was going to have a heart attack. The pain was so severe, I couldn't do anything else. The only thing I could do was call 911.
Luckily, UMass Memorial Medical Center in Worcester is just a few miles away, and their ambulance got there quickly. What did not come so fast, the bill for that ambulance trip, which showed up almost a year later for almost $2,000. Chris called his insurance company, United Healthcare.
I called United, and their excuse was that the particular ambulance that picked me up was not in my network, which is insane.
The bill total for the 4-mile ambulance ride was more than $2,800, of which United Healthcare paid just $879. They told him the rest was on him, $1,957.56.
Sorry you had a problem, sorry you needed emergency help, but we're not going to cover you.
He was in crisis, a real bad crisis.
The same thing happened to Lisa and Paul Golden, whose son had to be taken by ambulance to the hospital twice last May.
He was struggling, he was combative. It was just no way that I could have got him in a vehicle and got him down there safely.
Their town-owned ambulance in Halifax transported him both times, and the ambulance told them it wasn't in network for their insurance, Lucent Health, resulting in $3,700 in bills they were told to pay.
If your town ambulance isn't in network, what ambulance would be?
I don't know. That's a good question. I can't answer that question. I don't know.
For one ride, Lucent Health paid nothing, saying the ride was applied to their deductible. For the other, they paid only $281. A bitter pill to swallow for the Goldens because they didn't have a choice in the matter.
It's a 911 call, my son's in crisis. Whoever shows up is going to transport him. I don't have a choice. I can't say, well, no, I want somebody else.
The No Surprises Act passed in 2022 was supposed to eliminate most surprise medical bills. But Congress purposely excluded ground ambulances, in part because the nation has a complex system of municipal, hospital-owned, and private ambulance companies.
We need a solution, and we need it now.
Patricia Kelmar with the nonpartisan Public Interest Research Group was the consumer rep on the committee Congress set up to make recommendations around ambulance billing. She says they came up with a plan to standardize ambulance rates and limit costs for consumers while protecting ambulance revenue. But Congress hasn't acted.
We don't ever expect to have to call an ambulance, so we may not be realizing what we're in store for.
18 states have passed their own laws, but not Massachusetts. Kelmar says patients should negotiate with their insurance to pay more and the ambulance company to lower the bill.
If you said you didn't cover ambulances, I want that in my policy. I want to be able to understand it really clear.
Knowing that this could happen might discourage people from calling for help.
I thought the same thing afterwards. If this happens again, and it probably will, I will think twice before I call.
All right, so there's some debate tonight about the Goldens case. Their insurance says their town ambulance is in network, and so they only owe a small part of those bills. But the ambulance company says that's not the case. Since it is publicly owned, they can try asking the town fire chief to abate the bills. For Chris McGovern, United Healthcare is aware of this claim, and they say when a patient raises a concern like this, they try to lower the cost directly with the ambulance company. If there's an update to come on that, I'll let you know. If you've got a consumer story for me, you can email me, ben@wcvb.com.